now, we have been advocating, let me say, against teenage pregnancy and helping more young girls to stay safe. Most times, we just look at the other implications on the family, on the student, etc. But have we taken a minute to really think about the health implications that teenage pregnancy can have on the girl child, their system, their womb? Do we even wonder the kind of pain they go through getting pregnant at 12, 13, 14, 15, or even 16 years old? These implications can be so serious that even when they grow up and these things are not managed, it can go a long way to affect them. Today, we want to have an in-depth conversation about the health implications of teenage pregnancy on young girls so that we can all stay awake and help our young girls stay strong and safe. I am Martha with Spice. Let's take a break. I'll be back with more. Welcome back. It's the Reflection Show with me, Martha with Spice. If you have been following the show and following the activities of the Martha with Spice Foundation, you will realize that we have been so passionate in this past few weeks on teenage pregnancy. It's our little way in advocacy to contribute to the so much advocacy by other partners in helping to make sure that we reduce the number of teenage pregnancies. But today, we want to take a sit and look at the health implications. We sometimes, or most of the times, forget about this aspect. And I have been joined by Dr. Umar Aliu, who is a medical officer at the Tamale Teaching Hospital, and Madam Rahma Salifu, she's a midwife and the maternal and child health, also, I believe, at TCH, right?
Moshizongo.
Oh, okay, at Moshizongo as well. Thank you very much for joining me, sir and madam.
Thank you.
Thank you for having us.
So straight to the point, I believe we've all have heard about teenage pregnancy. How do you, first of all, let me start, how do you feel about it? And being medical officers yourself in that field. So how do you feel about teenage pregnancy, Madam Rahma?
Teenage pregnancy, from my side, I believe entails a lot. But mostly we just put it on the teenage child or the adolescent child. I mean, faulting them. But it takes a lot.
Dr. Aliu.
When it comes to teenage pregnancy, it's something that unfortunately sometimes we take it so lightly, which shouldn't be the case. In our line of work, usually when the patient just comes to us, usually we see a large number of patients, in a day. So when they come, we just, we don't really give them the needed attention. We just see them as, the next client on the waiting list. So we just attend if they have to deliver them, we deliver them quickly. But we know when it comes to teenage pregnancy, there's something extra that we need to do. But partially because of the numbers we see in a day, so we don't really give them the needed attention that they actually need. And so that is something I feel like maybe we could work on as health workers and not just see them as the ordinary or the
numbers
normal
are just coming.
Pregnant women that we receive at our facilities.
Okay, so to add to, let's look at the health implications. I see that you just mentioned that because you are just busy, so anybody that comes, I'm treating you and you are going. Exactly. But taking a bit attention to them right now, what are the health implications a bit different from the grown-up woman who is married and her body is ready to have a child? How is the health implication on the mother, that is the teenage girl, and also on the baby?
So when it comes to during the pregnancy, so we can categorize it whether during the pregnancy, during delivery, and even after delivery. So during the pregnancy, the major issues we face with teenage girls is mainly their nutritional status. So most of them, they are still growing. In fact, they need nutrients themselves to grow, isn't it? And once you are pregnant, you are adding another a human, so which also obviously needs nutrients. So you, the mother carrying the baby, you yourself, you also need the nutrients to grow. Then you've added another load.
Yeah.
So you are not nutritionally sufficient, but you are also supposed to, provide nutrients for the unborn child. So usually, the main issue is the nutrition. Then also, there also comes the other aspect of whether these mothers are mentally, capable of handling the stresses of pregnancy. Because even women that are, fully grown, it's not easy. It's not easy on them. Now, how more, a teenage mother. So those are the two main, during the pregnancy, the nutritional status. Usually, because they are not nutritionally sufficient, they also need nutrients to grow themselves. So the baby they are carrying obviously will not get the much needed nutrients to grow.
Okay.
So during pregnancy, then there's something called IUGR, intrauterine growth restriction, because the baby is not getting the needed nutrients. They are not growing to their expected weight, so they grow smaller than usual.
Okay.
So they grow smaller than usual, and also because the mother is also not getting the small nutrient that she has to share with the baby, so they are not also growing to their full capacity. So they are sharing the few that they have with the baby that they are carrying. And you agree with me that most of the teenagers that we have, or the teenage pregnant mothers we have, most of them, even to start with, are not even from a well-to-do home. So right from the start, they are already like 2-0 down. They are not even they don't have much to go with. So they are all nutritionally deficient. Aside that, they themselves, if they were from a well-to-do home, naturally, because you are in the teenage, you are also supposed to grow and need extra nutrients. But they are already not so well-to-do, so they are already 1-0 down. Then plus the pregnancy, so that's like 2-0 down. Plus the having to share the few nutrients that they have with the baby. Then, like I mentioned earlier, then the mental aspects. They are not usually mentally capable. They are, like I said earlier, they are kids. They need guidance from their parents. Now they are now also the mothers, so they are not mentally capable to handle the rigors of pregnancy.
Okay, but I don't have anything to add on that, on the impact of the baby and mother.
The impact too on the mother and the baby as well is premature birth.
Okay.
Usually they deliver before the actual time, the 40 weeks or the 42 weeks. Let's say they deliver sometimes around 36, 37. So there's premature delivery. And also there's also a high chance that the baby will have systematical issues. The baby's systems might not be developed as per the normal baby will have. So that is also a risk for the baby. Okay,
so let me come back to you on during the childbirth, like during labor, what are some of the issues they encounter? I think she began on that point I was about to get to. The day of the, like, should I say, wait, I've not given birth yet, so pardon me. So the labor is when the pain starts coming.
Yes.
Basically. The pain starts coming, and the labor, and the delivery is actually the baby coming out.
Yes.
Okay.
So it's a continuum. So
labor
till expulsion of the fetus. So it's just a continuation.
The delivery is when the baby's head is almost out.
Oh, okay.
Then out. That's the delivery process. But the laboring process is from when the pain starts to when the woman is like fully opened, and then the head is just out there and delivered.
I remember my mom told me when my brother's wife was to deliver that they said that it's not open. I said it's not open. They should find a way to open it. Then she laughed. That was just like recently, and they were like, "Asa, if there's no way they what they might that's not open. I don't know necessarily. So that place they don't just open it like that.
Yeah, that's true.
So how, like, what is the average time for labor And when it comes to teenagers, like how does it always extend more? Let's look at that, like just the labor time. Let me come to Dr. Abby.
Okay. So when it comes to labor, so labor is just the onset of the uterine contractions. You know, the womb or the uterus. In medical we call uterus, but generally we just say womb. So the uterus has to contract. You know, the tail end or the latter part of the womb, it comes to this organ we call cervix.
Okay.
So it's the cervix that has to dilate or open. So that's what's called the opening. So the cervix has to open. That's the entrance into the uterus. So the cervix has to open to we call it 10 cm. So that's full effacement. So usually before labor, the cervix is closed so that the baby doesn't fall out, obviously. But once the labor starts, it kicks in, the cervix has to open to make way,
small.
Yeah, for the baby to
but
come.
But why does it pain when it has to open?
So obviously the uterus is contracting, the womb is contracting. So you can just liken it to when you're having your menses. So when you're having your menses and you're having cramps, so it's just the uterus that's contracting, you know, to expel the blood clots.
Also, the menstrual pains too is a uterus contracting.
Yes, it's the uterus contracting to expel the blood clots that you are, you know, because the womb is, you know, shedding off, so it contracts to expel it. So it's the same as labor. So the uterus is contracting to expel the baby because it's time for the baby to come out. So it's that contraction that causes the pain. So that contraction leads to the effacement or the opening of the cervix till it gets to, you know, 10 cm or 4. So usually it's 0 cm, that is closed. So the contraction, you know, goes on, then it opens 1 cm, 2 cm, 3 cm till 10 cm.
So it's when it is 10, the baby can now come out.
Perfectly. Now
but some take even some within 3 hours. They can some within even 24 hours. They are still. Why is that different?
Exactly. So with that, I think you mentioned that was part the initial part of your question. So with we have primigravida. So those who have never given birth, nullips, sorry, those who have never given birth. So usually their time is longer, you know, because the first time the body is not, you know, blah blah, getting used to the whole process. So their time takes longer. So usually more than 12 hours, right? Then
24 hours.
Up to 24 hours. Then the gravids, you know, the multi-gravid, those who have already given birth, 1.
So if it's your first time, it takes longer.
It takes longer than normal.
Longer.
Why?
Yes.
Like so much longer sometimes.
Yeah, so much longer. Can sometimes take up to even 48 hours, you know.
Some 3 days.
Exactly. But the multi-gravid,
so
you know, so the multi-gravid, it's just shorter because they've gone through the process. So yes, it's just shorter. So sometimes that's going to take like 3 hours, even less. But the thing is, for the duration, sometimes before the woman gets to the hospital, probably they are already dilated to like maybe 5 cm, 8 cm before they go to the hospital. So say in that time they're going to use shorter time to deliver. But the calculation starts from when the cervix starts to open. You understand? So from 1 cm, that's when we start the timing. But usually most women, before they get to the hospital, usually those who have already given birth, they would have been, let's say, 6, 7 cm. So the labor has already started way long from home. By the time you are now seeing, is the time maybe they're already like just 2 hours or 3 hours left to, you know, they being full. But the labor would have probably already started way earlier than they got to, you know, the hospital. So I think basically that's
so with some teenage girls, what are some of the things you see in that regarding to teenage girls in labor, like when they come? What are some of the common things that you see with them?
They are pain bearing sometimes. It's not easy.
Okay.
Like to get their cooperation, it's not easy. Getting them like to cooperate with you in the labor. You know, because their bodies are not used to the mechanisms of labor already. So theirs is different. And sometimes the pain is like so much there that they can't contain if you don't take care. Like things can get complicated for you. Like they really get it difficult.
Okay, let me take you back a bit to antenatal. Do you think that more teenage girls are usually able to come for antenatal early?
Early. So ideally, they are supposed to come early, like early, very early. Let's say within the first 3 months of the pregnancy.
Oh yes, I know. But I'm just asking from the things you see at the hospitals. Do you think that more teenage?
So most times, when they are pregnant, sometimes they don't even say, or they don't even acknowledge that they are pregnant yet. Some of them, like there's a delay in coming for booking, that is coming for the first antenatal services. And sometimes, you know, the fear of societal, let me say, discrimination with adolescents, they hardly come to the facility sometimes.
Discrimination from the health workers?
From the health workers and society itself. You know, even sometimes when they come and they meet, let's say, for instance, the married ones or the older ones, there's some kind of like friction between them there, like at the service point.
Okay.
So I think that one too hinders them from coming early.
Okay. So have you seen girls who have been late for antenatal, and how has that been? Because we are trying to encourage them on some of these things, and like she said, because of discrimination they don't go, and it's not healthy for the baby. So in that regard, just take us through some of the dangers of not going to antenatal early, or any other thing you want to add on that.
Yeah, so with that, usually so when we're talking about teenage pregnancy, so to a larger extent, the health workers, we play a major role, but we also fail in that instance, because at our facilities, there are certain health workers that are sort of judgmental, you know, especially in this part of the world where there's this morals that we uphold. So if I'm in the labor ward and maybe a 15-year-old girl comes in labor, like right from the get-go, I'm already judging her. I probably don't know what's happened and this lady got pregnant. I don't ask any question, but I'm wondering why 15-year-old, why having sex, blah blah. So I'm already judging her. So I might not necessarily give her the needed or fair attention that I would have given to any other lady who's not a teenager. So that's one part, and the other part is the society. You know, they just walking. It's not easy for them to just walk into the the AAC meeting, maybe their mothers or their aunties, at the same area. You know, everyone starts to look at them. You know, what's happened? Young lady, why having sex? You know, those kind of looks. So it prevents them from coming to AAC early. And AAC, what's the main function of AAC is to identify risk factors or any issue that might make the pregnancy complicated or the delivery complicated. So then we tackle it before you get to labor. So that's what the AAC does. But because of these barriers, they fail to come to AAC early. So the time they come, they are already in labor. Most of them, they are actually in labor. So the risk factors that we're supposed to identify way earlier in the pregnancy, that's lost. Yeah. Now they are in labor. So those complications that we wanted to prevent, we can't prevent those complications. Then we have to now deal with them as the time they prevent. So the thing about the teenage pregnancy, they usually give us a lot of complications. Yeah. And like you said earlier, their pain threshold is just sort of non-existent. Like I said, it's painful. So we really have to bear with the the midwife, the doctor. Push. They don't want to push. They are childish, sort of to say, because obviously they're not fully developed. So they give us a lot of problems. Then if you're not cooperating with your midwife, you're not cooperating with your doctor, then definitely the pregnancy, the delivery is going to give us a lot of complications. Another thing too is because they are not fully developed, so the pelvis is not fully developed to handle the passage of the fetus. So you may have certain complications like obstructed labor, ruptured uterus, even fetal demise, because the pelvis is not fully developed for the baby to pass. Most teenagers, we don't even permit them to go through vaginal delivery. We'll have to do certain course, pelvimetry, so we have to assess the pelvis and see, that is if they come for the AAC, like I mentioned earlier, to see if this lady's pelvis is adequate for delivery. Then we can now permit them to try vaginal delivery. But if it's not assessed adequate, then we recommend that the patient undergoes cesarean section, because we can anticipate that if we allow this woman to undergo SVD, that's spontaneous vaginal delivery, they're going to have complications along the way. So those are the issues that we contend with when it comes to teenage mothers.
And sometimes do you Sorry, I'm just soaking myself in some of these things that you are mentioning. And you see, sometimes these young girls, do they understand these guidelines that you are giving them? Let's say, do that, do this. Do you have instances whereby they do not follow some of the health directives? Let me come to Madam Rahama, where you say, I know even older women might not do that, but today we are focusing on the young girls, and they are at a higher risk. Medications wise, they hardly take their medications and even other things. What is the risk on that?
Yeah, so the risk here is, ideally, before you get pregnant, or as a lady, you're supposed to be taking this vitamins, folic acid, and the rest before you become pregnant. But with the teenagers, most of them, they don't come for antenatal early, just as we said earlier. And that compromises their nutritional health, their systems at large. So this makes them they are at risk of having anemia in pregnancy. I guess,
anemia
in pregnancy.
Okay.
So they have low.
That's not having enough blood.
Yes.
Okay.
In them, and then they also run a risk of having high BP during pregnancy, or we usually call it pregnancy-induced hypertension. And there's also a chance that though the pregnancy is growing, the fetus might not be growing inside. So that's how come they sometimes give birth to low birth weight. Like the babies are usually small in size, or their weight is small in size.
Let's look at depression. Are more young girls at risk, as they call it, what, postpartum depression? That is after you've given birth.
Okay.
What causes that? I learned some people sometimes want to even, they feel like even killing the babies, or they don't even want to even breastfeed the babies. But in our side of the world, we say, she's a witch, she's mad, or they have probably charmed her.
Yeah.
Dr. Liu, take us through that.
So when it comes to postpartum depression, in fact, it's not only related or linked to teenage mothers. In fact, all mothers can get postpartum depression, but just that maybe in teenagers it might be more profound in teenagers than the older mothers. But I think that's one thing that we actually have to also look at when it comes to postpartum depression, because a lot of mothers are now getting this postpartum depression or postpartum blues. Some you can call postpartum
What's
blues.
making the rise in numbers?
Depression. I didn't get it.
So what is causing? You said most mothers. What could be causing that?
With that, I can't really pinpoint what exactly might be causing the increasing numbers of the postpartum depression. But when it comes to teenage teenage mothers, obviously, most of them don't get the needed support that they're supposed to get. So either the guy that impregnated her is not even willing to accept that he's the father of the pregnancy. Then the other part is her parents. Some of them will not even, give her the support. She now becomes like an outcast. So she's all alone. Once she's not matured fully enough, she's still growing herself. Now she has a baby to take care of. Once she doesn't have finances, once you don't have money, that one alone is a huge risk factor to put the lady into depression. Second, she doesn't know basically anything about breastfeeding. She doesn't know anything about taking care of the baby. So all these pressures combine and comes together to push that teenage mother into the depression. So she doesn't feel, she regrets having the baby, she doesn't want to breastfeed the baby, she's generally tired of life, she wants to end her life because there's no support coming from anywhere. You understand? Even the health workers also, once you deliver, you go home. We don't keep you at the facility. So there's no support from anywhere for the teenage mothers. For the few that get the support from their parents, they do quite well because the mother is around to help her. Oh, this is how you take care of the child. Put the baby like this. This is how you breastfeed. This is how you wash the baby. All that kind of help. So it helps them. But for most, you agree with me, they don't get that support. So it's makes them more predisposed to getting this postpartum depression.
Anything to add on that postpartum depression?
I think another problem here is them not being emotionally strong. Like, as he said, like they're not matured, they are not fully grown. So mentally and emotionally, they're not that strong to cope with the changes with them and then with the environment they are getting. And also after delivery, you know, there's some kind of hormonal exchange in the body that can also contribute to that.
That's true. So the hormones to come into place, like it's true. So, you know, pregnancy comes with a lot of hormones. You know, once you're pregnant, your hormones are all over the place.
Yeah.
You know, mood swings, you know, eating disorders. Sometimes they don't feel like eating or they eat too much. So all those hormones.
I like that one. They're eating too
Or
much.
just wake up and decide to start crying
Stuff like
Start
that.
crying because
because of nothing.
Just because for no reason. They
They're
just
just
start
emotional.
crying. You know, and all these hormones also, you know, play a role in causing, you know, those postpartum depression. Yeah, that's.
me, I want the one that you wake your husband up at 12 a.m. and say, I want you to fry egg with palm oil for me.
Roasted pineapple.
Roasted pineapple.
Yeah,
Or somebody will say, I
Roast out.
like the smell from that neighbor's kitchen.
Exactly.
You must go and get me that
it.
food. They say,
Exactly.
no. Or they will say, I want one particular food sold at Ababu by Mama Ria.
And
That is that particular food they
specific.
want.
And the funny thing is, you can even get them all these. The food gets there, then she changes her mind. She doesn't even feel like eating it again.
Yeah.
She doesn't even want to
See the
smell
food
that
there.
again.
It's funny. It's all the hormones. So sometimes the husbands too have to, you know, understand a bit. It's not easy, but
I like that. Before you wrap up, I'll let you talk to the husbands and the incoming husbands. Anyways, let's take a break. We'll be right back.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Mark is King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of kingdom dominion. The exploits of service. Things fall apart. Church without bleeding pulpit. Singles mingle and many more.
Welcome back to the Reflection Show with me, Martha in Spice. Today we are looking at the health implications of teenage pregnancy on young girls and how all of us can help them or support them to, deliver safely. We hope that we don't have girls getting pregnant, and when they get pregnant, we want to encourage them to keep it. Because if our parents didn't keep us, we wouldn't be here doing what we are doing today. So it is better to prevent it than to want to do something else to the baby. Now let's take a look at how parents, so if parents find out that their daughters are pregnant, what are some of the things they can do to help them, maybe in health-wise? Dr. Aliu.
Yeah. So with that, I think first, the first thing to do is just to accept it. You know, it's here. It has happened. So there's no need, you know, cursing, you know, bashing the lady. Just accept that has happened. So we need to, you know, give her the needed support. And I think once you accept her, you know, she still has your daughter. That alone is you know, it goes a long way to, you know, help the lady to, you know, have a very successful pregnancy, then delivery. And also, if the mother is still alive, at least you have gone through the process. So at least you can, you know, teach her certain tidbits about, you know, pregnancy, and encourage that she goes for ANC, or you make sure that when she's going for the ANC, you go along with her. At least it makes it easier for her than just allowing her to, you know, go there by herself. So you have to accept her into the family, you know, still as your daughter. Don't make her an outcast. Accompany her to all her ANC visits. Even if the husband still doesn't agree to, you know, own up to the pregnancy, you know that you are getting a granddaughter, a grandson, whatever it is. So accept her, accompany her to AAC visits, give her the needed emotional support, also take her through, what you went through, share your experiences. Like when you share your experiences with them, they also know that this is not abnormal. It's the normal thing that, everyone gets when they are pregnant. I think when we do this, it will go a long way to help them have a, successful pregnancy.
You are the maternal and child sector, or let me say unit. What are some of the major challenges you face in maybe probably after you have given the baby to the teenage girl? How is the reception like, and what they can do better? And like she said, what mothers can do to help their teenage daughters?
So after delivery, ideally you hand the baby over to the mother. But sometimes, just as we said earlier, some of them are not ready for that. Some don't even want the baby to come near them in the first place. But if they have the support of the mother or a guardian or a parent who is around, can help them cope with that. So in all this emotional support, physical support, all the support that they can get should be given at that time or at that moment for them to go through the changes that they are having within themselves and then their environment and then the emotions or attachments they'll have with the baby. If there's no support, the person cannot cope. And if the person is down, the person is low and or demoralized, that's when the person tends to shun the baby. And that one too will also pose another risk on the baby because breastfeeding might not happen. Since the woman is not ready to accept the child, breastfeeding will not happen. And if breastfeeding doesn't take place, the baby's condition will not also be all good.
As health practitioners, as your field, what do you expect a mother to bring or to do? Because sometimes the things we hear they insult them on is because they haven't brought this, they haven't brought that. So we hear that they have been discriminated, molested at the hospitals. So what do you expect them to bring when they are coming for delivery?
So there are some key things a pregnant woman should have, irrespective of whether you're a teenager or a grown woman. So ideally, you're supposed to have the delivery pad. You're supposed to have the delivery mat. You're supposed to have
the delivery mat, like yes, they'll put on their bed before they lie down.
A cotton-like mat. It's just kind of like small, not all that big, that you usually spread on the table, and then the woman lays on it to deliver. And then cut sheet. That one is necessary. The one that after the delivery you used to wrap the baby. Those are just the key and necessary ones that will be needed during delivery. So before delivery, when they come for antenatal, if the person is a regular antenatal attendant, or if the person accepts or stays with whatever education you give, the person comes with those things, because when they come, you list those things for them to get prior to the delivery.
Okay, Dr. Aliu, what do you expect teenage mothers, or let me say anyone going through the delivery process, what is your advice for them, especially if they are teenage girls? So
the most important thing about it all is the AAC. Very, very important. Yeah. It is very, very important, because it's the AAC where we pick up all these issues, then try to trash them out. Like you said, if you're a regular AAC attendant, usually they give them the list way ahead of time, so that you can get enough time to buy all those items on the list. So usually it's not like it's an impromptu to just come, or why don't, then that means you won't come for AAC. If you actually come for AAC, that shouldn't be a problem. And the other thing to usually is the finances. Like we're saying, the support that the teenage mothers need. Pregnancy is not easy. It's quite expensive.
Pregnancy is expensive.
It's expensive. You will do a number of tests, scans, a whole lot. If there are any issues during the pregnancy, that makes it more expensive. So if the teenage mother gets that support from either the guy that impregnated her or the parents, at least that one alone, it's okay. But to just leave the teenage mother to just face all these expenses, that one alone is just too much for her to bear. So for the things you need for delivery, that one way ahead of time, we are already informed. They have a list. Most of the hospitals, they just print a list for you, then you start getting them before you get into labor. Then, so once you are in labor, you are coming to the hospital, then you are coming along with all those items. There may be a few instances where maybe for one or two reasons the mother presents to the hospital without those items. I think once in a while they have those items at the facility for sale, but usually we don't usually like that because sometimes they feel like we are extorting them. So we just prefer that you come along with your own, delivery.
But let some to just be in town or be at work and labor starts and just get to the hospital and
So in those instances you have to buy the ones at the facility. Or you let someone from home. You can call
I'm told that they advise, maybe that's those who have cars. They actually advise that when you are left with in case they give you 2-3 weeks more before you put to bed, you either stop going to work and be at home where somebody can be near you, or you usually have your
baby stuff
in your car or very close, someone can bring. But sometimes I hear some stories, I hope it happens to me, like some people don't know they are pregnant. Or even if they know they are pregnant, their tummy is not big. By the time they know they are in labor, within 30 minutes, the baby is out. I even hear some teenagers who say that they didn't know they were pregnant until a particular month. And I'm like, when we were in school, we are told that if you stop seeing your menses, it means that you are pregnant. Is it that they keep seeing their menses till that time, or what really happens? And why do some people have smooth delivery? Is it that the uterus doesn't contract the cervix or what? What happens in those instances?
There's something called denial pregnancy, right?
Denial pregnancy. Denial pregnancy.
Yes. So they don't acknowledge that they are pregnant. Though all those things, the signs, the symptoms are within them, they don't still acknowledge they are pregnant. So somebody like that, the person will just wake up and go to the hospital and then put to bed and with them, or they usually say miraculous baby. The woman was pregnant, yes, but the woman doesn't acknowledge that she's pregnant until she puts to bed.
Some to 3-4 months before they know they are pregnant.
Before they know they are pregnant, yes. And even if sometimes they are pregnant and then they just rush them to the hospitals and then they give birth, or they rush them not so long and then they give birth, there's an abnormal labor we term as a precipitate labor. That one is out of normal. As soon as the person gets start getting contractions, everything just fastens or hastens like magic. It just happens within 1 hour 30 minutes, 3 hours, and the person has to leave
to bed.
So this sort of person, it doesn't take time. It doesn't move from the slow motion from the 1 to 2 to 4 to 10 cm dilation or opening before the woman delivers. It just rushes. The system just goes off, and then the person puts to bed.
So what I'd like to add to that is usually teenagers, when you have your menarche, so menarche is your first menses. So it takes a long time before it normalizes. So if let's say you had your menarche at 12, it isn't that every month your menses will be coming. So it can take years before it normalizes, where you get your menses every month, because the ovaries, the uterus, the hypothalamus are all getting used to the process. So it takes a long time before it normalizes. So for someone, let's say 14 years of age, who has had a menarche, say 13 years, so right from 13 years, the menses has not been regular. So it's still taking time. It will regularize, but it takes time. So as when she gets pregnant at 14 years, so she might miss her menses, and she just assumes it's just one of those months that she has missed her menses without necessarily being pregnant, but she's actually pregnant. You understand? So that one can be attributed to the fact that the menses hasn't yet regularized. So she doesn't know that probably she's pregnant, but most likely she's pregnant. Just that she still thinks the menses, she missed her menses because it's just one of those months. So that's where the confusion is. But then again, if you miss your menses for 2-3 months and you're not seeing it action, and you've had sex, it doesn't take a genius to know that probably you might be pregnant. So you just need to go to the hospital, or you don't even have to go to the hospital. Just go to any pharmacy, buy the pregnancy test kit and test, or go to the hospital for assessment. So that's where sometimes the confusion comes in.
But then as a teenager, it's very key for you to go to the hospital. Don't just go to the pharmacy or drugstore to get the test.
But it's a hospital that we fear that when we come, you'll be discriminating us that young girl, you had sex.
Even with the
that's
environment,
true.
we still encourage them to come.
Yes, that's true.
So what are you doing about youth-friendly services?
In fact, when it comes to that, there's what's the name? This organization, Mary Stopes, right? Mary Stopes. They are doing excellent work out there. I think that they are just those that actually provide the ideal or standard youth friendliness care to the youth. Usually in the hospitals. On my part, I might say maybe I'll try to be more accommodating, but for another doctor or another nurse might not be the same. So it just depends on who the teenager meets at the time she reports to the hospital. But I would say there isn't enough institutional policy training to make us be more accommodating to our teenage mothers. So it's more like dependent on the health worker or the doctor, the nurse you meet at the time you are visiting the facility. So I think maybe the institutions have to put in more work, either make a separate unit or increase the privacy. The main thing is the privacy. We don't usually have enough privacy for them. So either we improve on the privacy or make a separate unit for the teenage mothers, so where they will feel comfortable, where they will see their peers and not necessarily see the older women. When once we provide those,
that's the youth corners at the hospitals.
Exactly.
Do we have one in TTH?
I don't know why.
It was there. I don't know if it is.
For now, no. I don't think it's. I can't tell for sure, but from the top of my head, I don't think we have anything like that. It might be there, but I'm not aware.
But it is around the smaller facilities or the villages.
Yes,
the adolescent
health corners.
Yes.
I know PPAG used to really champion these things on their Ask and Guso project, but I don't really know. Let's take a break. We'll be back to wrap up. Welcome back from the break. We are here to take our final words on the conversation that we've been having. Let me come to you. Your final words on everything that we have spoken about. And please just touch on the teenage boys also impregnate our girls. What they can also do to help our girls.
So to start with, to help these teenagers, we need to curb the causes of teenage pregnancy. We need to stop child marriages. We need to give adolescents more attention. We need to give them more support, irrespective of whatever they go out to bring. As a parent or a guardian, you are supposed to put the adolescent on the right track or guide them onto the right track, right? But with the boys of adolescent teenage pregnancy, you tend to realize that they are mostly isolated. And this isolation makes the whole thing how do I put it? A generational thing, because they usually tend to be isolated, and when they are isolated, they get into drugs. Sometimes they get into deviant behaviors, which again can lead them to also impregnating another person. So it's kind of like a recycling thing that happens during a teenage pregnancy. So in as much as we give the women or the ladies or the girls or the teenagers some attention, the boys too really need attention, because we can't neglect them. If we neglect them, emotionally they'll be down, physically they might not cope, and their mental health is very important, because once they are not in a very good shape, accepting the baby and then the mother will be also difficult for them. So in all this, let's just accept that they've gone through or what they've had within them. It has happened already. Now the way forward is to help them. Stay with them physically. Stay with them, like all the support they can need or they would need, you should be able to give to them to cope or to come out from whatever repercussions that might also cause later.
Okay, Dr. Ali.
So what I would like to just add to the conversation we've had so far is to our lawmakers. I think I don't know if we are aware, the age of consent for consensual sex in Ghana is 16 years, but the age for marriage is 18 years. You see that it doesn't make sense.
I've never understood that thing. So you are saying they can have sex without getting married?
Exactly. It's something that has never made sense to me. In medical school, I remember when we debated a lot about it. It never made sense to anybody. Why a teenager at 16 can have sex consensually without any legal repercussions, but cannot get married at 16. It doesn't make sense. So we have to find a way of harmonizing those two ages. Either we peg both of them at 18 or peg them at 16. But obviously 18 will be better, isn't it?
Yeah.
So that's one thing. Exactly. So that's one thing I think the lawmakers need to really look at that law and put the legal consensual age to 18. I think that will also go a long way to reduce this, because at least if you get pregnant at 18, it's way better than getting pregnant at 16. Though it's not ideal, but obviously
we should pick all at 20.
That's another conversation for another day.
Yeah.
Then our guys too. The issue is it depends on who impregnates the lady. If it's an adult, at least the moral thing to do is just to own up, and be there for this lady. But once it's also someone like a teenager, I mean, what more can he do? There's little he can do.
You should also drop her from school and go to the labor room.
It's just about the person probably cannot fend for himself too. So both parents just need to accept, like you said, accept that it has happened. Then come together and make sure both of them, get out of it, without any issues.
Thank you so much for. You want to add something?
Yes, I want to add something. Teenage pregnancy is not the end. Teenage pregnancy, you have 3 options. You either keep the baby, or you give the baby out for adoption, or you can go for medical abortion if necessary. So
that one day we are not really encouraging it. We are looking at abstinence.
But if they don't want to abstain,
they will abstain. They have to abstain. You have no choice. You have to abstain. Or you can even use contraceptives for that. You can find the way to go around. You can use contraceptives for that. But you see, you need to really abstain, because on Saturday I was having a conversation with some friends, and I was telling them that look at the stress that sometimes I go through on production and stuff. You just get home, you are tired, you just go and lie down, you sleep. Most times I just take tea and I'm going to bed. And like you said, pregnancy is expensive, and having a baby is more expensive.
Yeah.
So with me, I can just take one bottle of kinky and I'm good to go. I'm going to bed. But if I have a baby, their food is even more expensive than my adult food.
Yeah.
That's true.
So we really need to make sure that we need to abstain. Thanks so much for coming. I have been speaking with Dr. Umar Aliu. He's a medical officer at the Townlet Teaching Hospital, and then Madam Rahma Salif, which is a midwife at the maternal and child unit at Well. Make sure that teenagers are really abstaining. We all have to play a role and make sure that we do not have a lot of young girls out there who are getting pregnant out of wedlock. It's been an amazing conversation. I am Martha Inspires. Please have a good night.
Hi everyone, my name is Faika, and this year's Youth Empowerment Summit by Matters Inspires was an amazing journey. From the speakers to the energy level of everyone here, I actually learned a lot, especially when it comes to raising my confidence, to being bold. And I also, one key thing I learned was that life is an adventure, or it's nothing at all. I can't wait to see all of you next year, and I can't wait to see what next year brings. This is my first time. Let me just start with, I was not there for the previous one, but this one has been very educative, inspiring. I got to even meet one of my role models, Ibrahim Mustafa, whom I've been looking up to for like the past, let me say, 2-3 years. And I got to meet him. He gave some very inspiring words. But the best thing I ever heard today was from Madam Antoinette Kofi, who said that you should dare to dream. Whatever you dream about, you should do it.
Do dare to dream. And the best time to dream is when you are a young person. But don't ever stop dreaming. Whether you are 50 or 60 or even 70 or 80, you can dream. about a better life?
So I am daring to dream because I don't know where life will take me, but I am ready for everything that life will throw at me, and I will take it with full vigor. And right now, I am just happy to be here, and I hope that they can organize this for the youth so that we can all witness some things like this, and then also learn to become better people in the future.
My experience at this year's Youth Empowerment Summit was top-notch. I learned so much from all the speakers, Auntie Georgina, Pastor Fant, Mr. Ibrahim. I learned to be bold and to be confident, and honestly, I can't wait for next year's. See ya!
Today is Youth Empowerment Day, and I happen to be here. It's very inspiring, and I'm very happy because I've learned to be myself. I've learned to be confident. I've learned to stand before others and to talk without shivering, and I'm very grateful to be here. I learned a lot from my principal, and she said, and I quote, that you should embrace your uniqueness and work towards your weakness to attain what you want to be and the better person you want to be.
There's no duplication of you anywhere in the world. So embrace your strengths and improve your weaknesses, so that you can become the bold person you aspire to be.
So I'm very happy, and I also want to use this moment to thank our only mentor, Mrs. Martha, for organizing such a great program for us to be able to attend. Thank you very much, and we wish to attend more and more programs like this. It's very inspirational.
Mohammed Rashida from Cal Point Senior High School, and I'm here for the Youth Empowerment Summit hosted by Martha Inspires Foundation. And the program is it's a very good program, and I've been inspired. And then one of the speakers mentioned that you should dare yourself. You dare yourself to dream, and then failure should also be a hindrance. No matter what you do, failure shouldn't be a hindrance. You failing doesn't mean you should stop. You try until you make it. And I really love that, and I've really been inspired.
This is not my first time of being at the Martha Inspires Youth Summit. I was here before, this is just my second time. Really coming here, I did expect a lot. I expected that when I come, I would learn new things. I would get to network and socialize with other people. And what I have really learned from this summit is that for you to get to do something, you need to be confident enough for you to take a bold step. And also, you don't just get your achievements or achieve your goals whilst being in your comfort zone. You need to get out of your comfort zone in order to achieve your goals.
We have to believe in ourselves, and we have to dream big. I mean, for me, what I'm taking home today is bigger and bolder. Whatever you have to do, you have to think big, and you have to be bolder. If you are bold, be bolder. If you are not bold, be bold. If you are thinking small, think big. And if you are thinking big, think bigger.
And I would like to say a very big thank you to Madam Martha for organizing such a wonderful program for us. And I hope next year she does same, and I'll be very glad to attend. Thank you.